Hi, in this video I'd like to talk about late miscarriages, some of its causes, and also a patient case study that we had recently. So late miscarriages happen much more infrequent compared to early miscarriage. So the statistics generally go like this. So 8 out of 10 miscarriages end within the first 12 weeks. So most miscarriages end in early miscarriages, which means within the first 12 weeks. Rarely do we see them end after 12 weeks, but if they do happen, there are a few causes. The first cause is a short cervix, which means the cervical length in the second or third trimester is below a certain length, which means it will cause some problems, which means the cervix might open, causing the pregnancy to protrude and end in a miscarriage. This can be either acquired, which means acquired short cervix, or a congenital short cervix, which means you are born with it. Either you are born with a short cervix or you acquired it via surgery or certain procedures of the cervix. Second cause is a cervical insufficiency, also known as incompetent cervix. So as the name suggests, the cervix is unable to withstand the pressure and the weight of the fetus in the second and third trimester because the muscles and the tissues there are much more weaker than a healthy woman's cervix. So when they are unable to withstand the pressure, they dilate prematurely, causing the pregnancy to end in a miscarriage in the second and third trimester. This can also be a acquired cervical insufficiency or a congenital cervical insufficiency. Now, in our patient case study, she has an acquired cervical insufficiency, which we'll talk about later. And lastly is a hyperemesis gravidarum. Hyperemesis gravidarum not only leads to early miscarriages, it can also lead to late miscarriages if it is allowed to sustain for a long periods of time during pregnancy. So some women do not know that they are experiencing hyperemesis, especially those in the first time. Very similar to our patient case study, she did not know that she was experiencing hyperemesis because of how infrequent this case, how rare this disease is. There's no awareness, nobody's talking about it. So she allowed it to sustain for over long periods of time into a second and third trimester, and because of the severe vomiting that comes with hyperemesis, the severe contractions of the uterine muscles and the abdominal muscles caused her to lose this pregnancy. So how did she acquire cervical insufficiency? For this patient's case study, her first pregnancy ended in a miscarriage because she developed hyperemesis, and hyperemesis alone. She did not have any other condition. But in her subsequent pregnancy, she did not develop hyperemesis as severe as in her first pregnancy, and it went into 15 weeks and 16 weeks, way past the first miscarriage. So she thought she was secure and that maybe she had a chance. But in the week 20 of the pregnancy, it ended in a late miscarriage because the cervix dilated prematurely. This is clearly a cervical insufficiency. Now we strongly suspect that this cervical insufficiency is an acquired one caused by a previous hyperemesis because of the severe contractions, the contractions of the uterine muscles and the abdominal muscles, of the vomiting and the nausea that she's experienced. This might have triggered the muscles in the cervical neck to be either injured or teared, some form of trauma that led her to acquire this cervical insufficiency, cervical incompetency. So in order for her to secure a healthy pregnancy, she needs to deal with two of the underlying causes, and we here at Antai Hospital specialize in treating both of these. Hyperemesis gravidarum, as you all know, we specialize in treatment of HG with our proprietary HCG desensitizer. So we advise her that she should just come for 1 week before pregnancy. As long as she's administered, almost a 99% chance that she will not develop hyperemesis. No symptoms at all. As for her cervical insufficiency, we do things differently in Antai Hospital. Most hospitals can treat a cervical insufficiency, but how do they do it is that they use conventional method, which is a cervical circlage, stitching a cervical ring on the cervical neck, and they also put it in the inaccurate spot, which is why sometimes it doesn't even work with varying success rates, and then during labor, because of the stitches, it causes a massive hemorrhage, massive bleeding, potentially threatening both the pregnancy and the mother. So to avoid all these complications, how we treat cervical insufficiency is that here at Antai Hospital, we use 3D laparoscopy to secure a flexible ring that is an inner orifice and there's an outer orifice. And we secure the ring in the inner orifice with no stitching included. Now this is our specialization. We do this surgery with no stitching, so when the labor happens, the ring is easily detached with no potential of infection or bleeding or any trauma.